Hi, thanks so much for joining us today to talk about our virtual Kansas Rare Diseases Day. These are some wonderful pediatric experts who can help us learn more about how we might be able to help Kansas with a Rare Disease Advisory Council. And so, can you take a second to introduce yourselves?
Yeah, so thank you, Donna, for having us and for that brief introduction. Like you said, my name is Kari Harris. I am a pediatrician. I almost exclusively practice in adolescent health now. But as Donna said, I do have the privilege of serving as chair of the Kansas Maternal Child Health Council, and I direct our adolescent clinic at KU in Wichita.
And I'm Sid Sivamurthy. Like Dr. Harris, I'm also on faculty at KU, and our passion is teaching and service provision, and taking care of the children that we do serves our focus at KU very well. Um, my interest is particularly the care of medically complex children, and in that role, I am the director of the Medical Complexity Clinic. I also am primary care doctor to several medically complex children. I also run the asthma clinic, so it lends itself well into the special needs children's care. So those are my roles in the clinic.
Thank you so much. I shared with you the NORD State of Kansas report card that lists a bunch of different categories that it rates us on. Have you had a chance to look at that report card? And if you have, what impressions did you have?
Kari, do you want to go first?
Yeah, sure. If I can find my unmute. Yeah, so I did look at that. Thank you for sharing that information with us. I was not aware that that existed. And I think, initially I was just taken aback by how poorly we as a state are doing in medical eligibility, and how complex that process is, as we've previously discussed, the three of us, and how it's difficult even for us as physicians to understand that process. And then we are expecting parents who are under extreme stress to be able to understand that. And so between that and the out-of-pocket costs, I just see this incredible, maybe unnecessary burden that is placed on these parents to try to figure out that system. And I would love to be able to see us do better in those areas.
Great, thank you. What
I,
about you?
those numbers were very enlightening. It's really nice to have comparative scores with other states, so we comparing like for like. It's nice to have benchmarks, but in the end, I felt like those scores, what they highlight simply is that there's just a lot of work to be done.
Mm,
And
mm,
I don't believe that any of the stakeholders, be it the patients, be it the families, be it the hospitals, the community workers, anybody is going to be satisfied with less than an A plus on anything. I mean, sure, it's aspirational, but it
mhm.
certainly is a benchmark that's worth aspiring to. Um, so in that sense, I think it kind of at least sets the tone to say, okay, this is where we're at. It's not a criticism. It's just merely where we're at. And we just let's all just roll up our sleeves, identify things to fix, and just get on with the work of getting it fixed.
Very cool.
I like that.
So where would you start if we had a rare disease advisory council? Where would you even start? Or where do you think we could make the biggest impact?
I
Uh,
don't have a good answer for this. Oh, sorry. I can jump. Okay. I don't have a great answer for this. I think, we have discussed in other conversations how important that just having the family or patient advocates on advisory councils are, and how much education they can provide to the other stakeholders at the table. And we talked about that just yesterday, about you providing information to your PCP on the rare diseases that your daughter had. And I certainly have patients in my practice as well that are constantly educating me on that. So I think just having all those stakeholders and voices at the table are very important. And I think I would want to hear what they said. I would want to know
Mhm.
what direction they wanted us to go, what challenges they wanted us to tackle first, because I think that that's where you're going to make the biggest impact, where you have most people behind it, and have their skin in the game, if you will.
Mhm.
And the problem is so multifaceted, isn't it? It's a Medusa. I mean, you can't go after one head and expect, things to fall in line. And so I agree with Kari. I mean, there's just no simple answer to this. I wish it were. I mean, we'd have gotten fixed by now if that was the case. But my view from the trenches, as it were, and my preference, obviously, I'd want to listen to the advisory council and what they have to say. But my view would be, it would help us greatly if we had centralization of care. You know, what I mean by that is, this is a relatively small group of patients. If they could get good, consistent care because they are referred to a a dedicated group of individuals, who do this on a daily basis, they're far more likely to get a consistent workup, a consistent kind of path towards a diagnosis, and more importantly, a management plan that is cohesive, that is workable, and so it's quite important to have clinics like that. And that was where KU tried to start with the medical complexity clinic. And I know Kansas City has the Beacon Clinic, which is again an amazing resource. So, but the problem with running clinics like that are purely, I mean, simply put, it's a money losing proposition. It needs, we cannot run a clinic like that within the confines of what is expected of us in healthcare. Right, so we do need funding. We are lucky enough to be supported by the Kansas Department of Health and Environment, but even that only goes so far. So I think it's really important for everybody to look to try and support clinics like this. Funding is one way to do it. Resources, because we don't really have even enough people to work in these clinics. So I'm not able to perhaps run it as much as I'd like to, or have as many clinics as I would like to. And an added benefit to having centralization like this is that I see that clinics like this have this force multiplier effect, because not only are you taking care of the patients, it gives you ample opportunity to teach the future doctors, and we have physical therapists come in. I mean, any professional who works within this clinic has the opportunity to pass that knowledge on, and that can only happen with centralization. And you add another layer to that, the ability to do research. I mean, you have this ready pool of people that can be tapped into for anybody who's interested in research. So I really think that from a provider perspective, I think it would be really important to have some form of centralization.
It's wonderful. I appreciate what you do every single day to make life easier and better for kids that are facing things they shouldn't even have to imagine, and their families. To know that they've got a foot soldier with them means more than I can ever say. So thank you both.
Well, likewise, Donna, thank you for all you do.
Thank you. Bye-bye.
Bye.
Bye.